You have a 20% chance of dying due to heart attack. Worldwide, about 20.5 million people die each year due to heart attack and stroke. My youngest bypass patient is 28.
Hi, welcome back to MedTalk. Today we're joined by consultant cardiologist Dr. Zacky Haniffa. Hi, sir. How are you doing today?
Hi, Shalami. I'm very well. How are you?
Good. So we just want to focus today on awareness regarding heart diseases. So when we say heart disease, first of all, there's a fear that comes in, right? So most of the people, as soon as you say the word heart attack, the word heart disease, all of those creates a lot of fear within the general public. Is a heart attack such a sudden thing and you can't really say that it's going to happen beforehand? Or can there be something I can, look after?
Yeah. Heart attacks equal to death. That's what the community says, isn't it?
Yeah.
Fear of death.
Exactly.
Everybody wants to live long, isn't it?
Mm-hmm.
So I'll give a small background what is heart attack, how severe it is. Worldwide, about 20.5 million people die each year due to heart attack and strokes. That is a cardiovascular disease, basically.
Okay.
And you have a 20% chance of dying due to heart attack. Would you like? I mean, your cause of death. No,
Right.
no.
Okay.
Me, about 25%.
Okay.
Right?
Okay.
So that tells the story. Obviously, we are going to be in a sort of a bad wicket in terms of if you get a heart attack.
Mm-hmm.
So there are a few things. Yes, the question is valid, but the sudden severe heart attack usually doesn't have warning, unfortunately. But in a small sort of small proportion of patients, patient can develop angina. You know what is angina? They can start having a chest pain with sweating. The patient, sometimes they come and say they used to walk nicely, do all the exercises, everything. Suddenly they say, last day or two or a week or so, I can't do whatever I was doing earlier, right? I feel out of breath. There may be a chest discomfort, chest pain. Some even say teeth pain, and some say gastritis.
Exactly.
Yeah, some say shoulder pain. So the message is, if you are an active person and you have been active, walking and doing things, and suddenly you can't do it anymore.
Okay.
Anything above your umbilicus,
Okay.
right?
Yeah.
That's something you need to be worried.
Okay. So I want to touch on one thing you said. So you said people talk about teeth pain or jaw pain, shoulder pain, maybe gastritis. Now, gastritis is a very common term that we use. I mean, I think every household has used it, right? So any sort of chest uncomfortability, oh, I didn't eat well, must be gastritis, must be gastritis. How, in your experience, have you seen how often is it that patients put off seeing a doctor thinking it's gastritis? Is it a very common thing? I would suppose it is.
It is. It is a very relevant and very serious question, right? Some people come and say, while I'm running, I'm getting gastritis.
Interesting.
Obviously not, right? So if you're getting something new in your life, which you have never experienced earlier, and you're worried about it, obviously, don't put it as gastritis. Let the doctor make the decision, right?
Right.
I usually ask, when did you get your medical degree?
Yes,
That's a good question to ask, even at 70s, 80s. You know, this culture in South Asia and Sri Lanka, India, this subcontinent, we have a culture that we don't like to sort of label as diseased.
Right.
We try to be, okay, I'm healthy. Despite
okay.
heart attack, okay, I'm fine, Dr. Kumari, right? That sort of mentality, that is, the health-seeking behavior, we call it in psychiatry. So don't put, say, if it is a 14-year-old or 18-year-old who had a spicy food and coming with a gastritis, obviously that's fine. For the patients, say about 25 and above, nowadays, the age of getting a heart attack is down and down and down. My youngest bypass patient is 28.
Wow.
What do you believe? Right? So especially ladies, it's a issue nowadays. A lot of ladies at 35s, 40s, 45s, they are getting heart issues. It is a real concern for the family. So don't put away to gastritis. If especially even a 1% doubt, please come to a doctor and get the testing done, which is, nowadays widely available, unless in, say, 20 years back or something. Now, widespread everywhere, the basic tests are available. It's a very simple things, right? So please save your hearts.
Yeah. So, one more thing I want to touch on. You just said that, as we've noticed, the incidences of heart attacks or heart diseases taking place is getting younger by age. Initially, we used to think that it's 50s, 60s. I mean, even 50s, 60s was quite surprising for some people when you talk to them. You're talking about 70s, 80s. And now we've seen a trend where more and more younger people are having these type of things. Is there something that we're doing wrong in our generation for that to happen? I mean, seems odd that, all this time it was not there, but now we're having younger and younger people having more incidences of cardiac disease.
Exactly. You're asking a lot of important questions, interesting ones, right? Is your generation or my generation?
Well, if it affects mine, it probably affects yours as well.
Of course. Once I was a trainee, say, I'm still young.
Of course.
Yes. I was a trainee way back in, say, 2010. When I used to do the procedures, angiograms, our this is not research, I'm telling my experience, I'm telling. So it is maybe around, we used to see a lot of patients around 60 plus, 65 plus. That is our list. Say it's a long list, 14, 50 patients. Most of them are okay, even okay.
Yeah.
Right? But after becoming a consultant last 10 years or so, I'm seeing the patients, especially last 5 to 10 years. My average age has come down to maybe around 45, 50. I'm doing these things. And it is very relevant in terms of the family and in terms of the country per se as economy perspective as well. Because these are the brunt of the people who contribute to economy of the country.
Yeah.
And once they become diseased, heart failure or deaths, it is going to adversely affect our economy itself. And if you take the microeconomy in the family, most of the time, this young either father or mother with young children, their spouses, their extended family. Sri Lanka has a culture where they look after the extended family as well. If one member at a young age they dies, it deprives the entire family.
True. Yeah.
Right? If they end up in heart failure, that deprives the entire family. I have a lot of recent deaths in 50s and 45s and similar like that due to heart attack leading to heart failure. Unfortunately, we don't have a transplant program in Sri Lanka. So a lot of issues are going on. These are very serious concerns. And you're asking me why, right? Yes, South and Southeast Asia, there's something to do with our genes as well, unfortunately.
Okay.
But we have the same gene. The genes can't change over 2 decades.
True. Yeah. Exactly.
Of course, right? The genes are dormant. You see, it's a substrate. Once we give the proper environment for that bad gene to act, that flares up.
Right.
So
Okay.
now, Sri Lanka is in a transit from our sort of olden culture to the sort of modern.
AI generated.
We are very famous to pick the bad things from the Western world, right? So we have picked our fast food chain. I always say, if you drive from Colombo, if you take Dehiwala station to Kalpiti station in the Marine Drive. What are the businesses you observe?
Most restaurants, fast food restaurants.
Yeah. Who are the crowd there? Is it 80-year-old gentleman?
No.
Or is it?
It's the young people.
It is flocked by all our young generation.
Working professionals.
Right?
Yeah.
And last almost like 7-8 years, Sri Lanka is undergoing a tremendous stressful situation for youngsters. We had our COVID.
Yeah.
We had our Easter blast.
Yes, we
We
did.
had our economic crisis, political instability.
Mhm.
Lot of things are going on, and our younger generation is absorbing all these social things to their head. And many people has migrated. Remaining they work in different hours.
Yeah.
Their sleep is adversely
Sure,
affected.
yeah.
Their stress level is more. Fast food culture, and from the peripheries, they are coming to Colombo without family. They are bound to eat whatever is available, right? And on top of that, with the stress, we do see the substance abuse, right? Smoking, they see every software developer, they say they don't get anything work in their brain unless they puff a cigarette,
Yeah.
right? And it leads to any other things like ice. So sometimes many people I have seen KG.
Oh, wow.
You know what is KG?
Yeah.
Have tried?
Nope. No. Too scared to.
So KG, I have seen youngsters coming at 25 with multiple arterial clots.
Oh, wow.
Right? In my experience, I have seen a lot of patients. KG is famous for that. Cocaine? Never tried?
Nope.
Yeah. Cocaine is another thing that goes into severe vasospasm and hypertension, lead to heart disease, strokes, and many other things.
These are
So
the
I'm
type of
taking the
things that a young person doesn't actually know. They just know it's like, oh, it's 15 minutes. It doesn't do much bad for you. 20 minutes a day. I lose one day. I release my stress. That's what we're thinking as young people, right? But
yes.
multivascular, that means most of the vessels are affected in all of this.
Yeah, it has two sides. One is addiction is something which is progressive,
Hmm.
right? If you are addicted to sweet, say a young child, till we introduce the sugar or salt to their food, they never ask for sugar. You got babies?
No.
Not
No.
married.
Married, but no kids yet.
Right. So the babies, usually we don't introduce sugar or salt to their diet. It is our fault that we introduce at some age and they crave for it.
Okay.
Right? It's
Yeah.
interesting.
So they don't know what it is
They don't know what
until
it
you
is
introduce
until
it.
you introduce.
Okay.
Once we get introduced,
Mhm.
the child is addicted to sugar and they will crave for more and more and more sugars.
Yeah.
Understand?
Yeah.
So addiction is something, it's a chemical reaction in the brain. Dopamine, of course, you might know. So there'll be addiction. Once they start, especially ice, is something which is, but as once you get it, you get addicted.
Wow.
Right? And similarly, cigars and multiple other things. And they have good reason to justify also, because I'm stressed, I'm away, I'm without my family, and blah, blah, blah. So, right? The other part is once they're addicted to the long-term issues, then only the problems comes there. So there are short-term issues where they can go into vasospasms and can get acute heart failure, strokes, and many things. Once they go into long-term addiction like the cigarettes and ganja and whatnot, it can affect every bit of your cells. Right? You can get cancers, you can get COPD, you can get strokes, you can get whatnot. Of course, you know.
Yeah.
Right? So addiction is something we need to contain so quickly. And also, for all these, the government policies are also important. We'll come to that in another discussion altogether. Right?
So, when you said that the younger generation is dealing with stress, a few days ago, I had one of my friends who we randomly did a check of his BP, and it was considerably high. And the statement he said was, "Oh, that's normal for me because I'm quite, I'm working in a kind of construction stressful place. He's typically running a construction site. Is that even a factor, or is that normal to think like that, or high BP is just
Of course, it is not normal to think like that.
Yeah.
Obviously, it has repercussions once they get the pressure. You're talking about high blood pressure, aren't you?
Yes.
So the high blood pressure, again, it's a disease which can lead to multiple things. Sometimes we call it a silent killer, this cholesterol and sugar and whatnot, right? So the initial stages, they don't feel anything. And many people come and say, Doctor, I'm good. When I feel bad, I take the tablets. Right? The sugar, I know when it is high, then I know to swallow a metformin or something. Right? As if they are having a gauge in their system saying that, okay, now it is blood pressure is 140 and I need a tablet. I'll be love to have such a technology.
Device.
Oh,
Yeah.
of course, nowadays we have blood pressure monitors that translate blood sugar monitors. We can implant into the skin and that translate into your apps. That is true. But that facility is not available in each and everyone, right? So blood pressure, I'll introduce a small concept for you today. That is called, it's a very important concept. It's a modern concept called life course approach. Life course approach for NCDs, the non-communicable diseases, put all together in one bag, like pressure, your diabetes, your cholesterol, your heart disease, everything in one bag. They have common origin, right? So you have to hit it hard before it occurs.
Okay.
Right? Where do you think it starts?
I think genetics. Because what we understand from people who say that they have high BB1, my father had it, my mother had it, I'm prone to it, because it's in my family and it's just taken as a...
So whom should we concentrating more first?
Well, the parents.
Yeah, the mother.
The mother, okay.
The mother who is pregnant, that is where we start.
Okay.
Right? So this is called life course approach. We start with a mother, a pregnant mother.
Okay.
You should look after her nutrition, her weight gain, what she eats, right? How her mentality is, how well her mentation is looked after. Everything is written in the baby. It is called genetic programming. Understand? So if the nutrition is bad in the mother, if the mother gets the high blood pressure, if the mother has the gestational diabetes, obesity, that is all sort of, while the baby is being, each cell is dividing, that is incorporated there. Later on, there is good evidence to say if there is a mother who has these bad things, that can have the increased chances of high blood pressure, diabetes, heart disease in the later life, right? Then we come to once the baby is born, what we are giving, are we breastfeeding nowadays? Mothers are going to work.
Really?
Right? So at least 1 year or up to 2 years, we need to breastfeed the child. That gives the entire nutrition, the bond between mother and the child, and a lot of things are happening there, right? Then the next stage, what we are feeding the child, whether it is healthy food, whether mothers are cooking the food at all. So I can keep on talking. This is called life course approach, starting with a mother, healthy motherhood, how we care the baby, childhood, what we are doing. Childhood, there are two sides. One is childhood obesity is a bigger problem now in urban areas. On the other hand, some children are starving to this in the peripheries. Right? Both are bad equally. Understand? So this is called life course approach. Once we come to another stage, then we need to start screening, exercising, all that. So it goes on and on and on. Once they get a heart attack, then secondary prophylaxis, everything. So it is called a life course, COURSE approach. Right? So this is where we need to concentrate.
Interesting. Well, you heard it here first with Dr. Zacky Haniffa at Durdans Hospital. I'm sure a lot of people have a lot of questions about, all of these information that you've got. If you do, drop us a comment, drop us a like, send us a message. We'll be quick to get back to you on your answers. And thank you, sir, for joining us today. It was very informative. Really, thank you so much.
And the last thing for you forget to say is we can help all these patients at Durdans.
Definitely we can. You heard it
One
here
of
first.
the premier hospitals in the country and in Colombo City.
That's true.
The heart of Colombo.
Yes.
Thank you so much, Salami.
Thank you, sir. Thank you. Have a good day.